Now, an arteriovenous malformation is an abnormal tangle of blood vessels within the nervous system, and it has three structures to it. The artery that feeds the blood into the tangle of blood vessels, which is called the nidus, and then from the nidus it goes to the draining vein, which is the third structure. And as neurosurgeons, we have to be able to clip the feeding artery first before we remove the nidus, or the tangle of blood vessels, and then we finally put a clip on the draining vein. Now, that's just one way that we can treat an AVM, through an open approach to surgically resect the arteriovenous malformation. Alternatively, you can radiate this arteriovenous malformation with something called stereotactic radiosurgery. It's a process where the machine will introduce several different beams of radiation from various angles. Individually, these beams of radiation are not going to do much harm on the way to the nidus. But the idea is that when all these beams converge together onto a focal point, it's going to have a profound impact. And eventually, over time, the nidus can actually shrink. Now, some AVMs are best treated with an open surgical approach, whereas others are best treated with a non-invasive stereotactic radiosurgical approach. Removing an arteriovenous malformation from the brain is a lot like defusing a bomb, because the resection relies on a specific set of steps that must be done in order, otherwise it can be fatal for the patient.